Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This will summarize the article titled, Characteristics and Outcome of Suspected Cerebrovascular Disease in Dogs. 66 cases, 2009 to 2016. Introduction. Cerebrovascular disease, CVD, is a condition that affects normal brain function due to infarction or hemorrhage, resulting in temporary or permanent damage to the brain. CVD is an escalating issue for clinical and public concerns in human subjects and was identified as the fourth leading cause of death in Japan in 2015. Although the occurrence of CVD in the veterinary field has been reported, clinical signs, diagnosis, treatment, and prevention remain unclear. Diagnostic criteria for brain infarction proposed by Girosi et al. Includes acute onset, non-progressive course, intracranial signs, and cerebral spinal fluid results compatible with brain infarction. However, reports show that clinical signs can progress 24 hours after disease onset and variable cerebrospinal fluid results have been reported. Previous studies have reported seizures as a rare clinical sign of CVD in dogs, but a report shows 56% of cases with CVD and seizures. The aim of this retrospective cross-sectional study was to characterize the clinical signs of CVD in dogs in Japan, where the clinical signs for CVD need to be clarified, given the discrepancy between previous reports and primary case reports, materials and methods. The study is a retrospective case series, nested in a cross-sectional study that included records from November 2009 to December 2016 of dogs that came to the Kyoto Air Veterinary Neurology Center and suffered from cerebrovascular disease. Only cases where CVD was diagnosed as the responsible lesion by neurological examination were included in the study. Dogs on long-term corticosteroid treatment were excluded. Permission to use blinded case information was obtained from each animal owner during their first visit to Kyoto AR. Clinical data from Kyoto AR, a secondary medical care facility, was used in this study. Data extracted from the medical records included breed, sex, age, weight, history, physical examination findings, neurological examination findings, MRI findings, concurrent disease at the onset of CVD, clinical signs, location of the infarction, and month of disease onset. Clinical signs such as gait abnormalities, seizures, cranial nerve abnormalities, head tilt, vision abnormalities, circling, altered mentation, head turning, and behavioral abnormalities were recorded. Cases with multiple infarctions and single multiple transient symptomatic episodes were not included in the suspected transient ischemic attack group. MRI was done using a 0.3 Tesla permanent magnet open MRI system with a human knee coil or wrist coil, depending on the head size of the dog. Meglumine gabapentin was administered IV by hand at 0.2 ml/kg, just before gadolinium contrast T1 weighted image acquisition. Infarcted vessels in each case were identified via MRI. Among the following vessels: perforating arteries, the striate artery, proximal perforating artery, distal perforating artery, caudal perforating artery, and branches arising from the vertebral artery and the main cerebral arteries: the rostral cerebral artery, middle cerebral artery, caudal cerebral artery, rostral cerebellar artery, and caudal cerebellar artery. A lacunar infarct was defined as an infarction of the perforating arteries, and a territorial infarct was defined as an infarction of the main cerebral artery. Cerebrospinal fluid was collected by cisternal tap, and the normal reference range of cerebrospinal fluid analysis was considered 0 to 5 L in cell count, 25 mg/dl in total protein, and 1.004 to 1.006 in specific gravity. Additional tests performed on the cerebrospinal fluid included cytology, color assessment, PANDI test, anti-canine distemper virus antibody test, and anti-GFAP antibody test. Blood-contaminated cerebrospinal fluid samples were excluded from analysis. A questionnaire was distributed to primary clinicians asking for information on the outcome of referred patients. The outcome for each case was defined based on the results of the survey. Cases involving dogs with disorders of the brain other than CVD were defined as the control group. Statistical analysis was carried out to compare the age distribution between control and CVD dogs. Compare the incidence of infarction type, cerebrospinal fluid abnormalities and albumin dissociation, and evaluate the relationship between concurrent disease and outcome. Logistic regression analysis was performed to compare the incidence of CVD in each month, with statistical significance defined as p0.05. Results. Cardiovascular diseases is a relatively common condition that affects dogs of different breeds. A total of 122 CVD cases were extracted from 5,312 patients that visited Kyoto AR during the study period. Of these 122 cases, 1.2%, matched the subject selection criteria of this study and were included in the analysis. 38 dogs were males, 19 neutered and 28 were females, 18 spayed. The MRI examination was performed in all 66 cases between 0 and 127 days after disease onset. Among the 66 cases, gait abnormality was the most frequent clinical sign, 53/66, followed by seizures, 26/66, cranial nerve abnormalities, 17/66, head tilt, 17/66, visual abnormalities, 13/66, circling, 10/66, altered mentation, 10/66, behavioral disorders, 8/66, and head turning, 6/66. Various clinical signs were present in the CVD cases, and clinical signs specific to CVD were not detected. With regard to the age of the control dogs, the average age was 7 years 2 months, and the median age was 7 years, with a range of between 10 months and 18 years. For the dogs with CVD, the average age was 10 years 7 months and the median age was 11 years, with a range of between 5 years and 15 years 8 months. The age distribution of CVD was significantly different from that of the control cases in the study. The average age of the CVD, 10.6 years, was significantly higher than that of the control cases, 7.2 years. A total of 53 small breeds and 13 large breeds were included in this study. At the onset of CVD, the average weight was 10.3 kg and the median weight was 8.0 kg. with a range of between 1.7 and 44.7 kg. There were significant differences in the rate of each infarction type in large versus small breed dogs. In large breed dogs, lacunar infarction was more frequently observed, whereas, in small breed dogs, the territorial infarction predominated. The infarcted vessels in dogs with CVD are shown in Table 3. A total of 105 infarct lesions were observed. Multiple infarctions were observed in 25 cases. The month of CVD onset was included in the medical record in 59 cases. Logistic regression analysis was used to evaluate whether there was a statistical difference in the incidence of CVD in each month. The incidence rate of CVD in August and December fell outside the 95% CI of the estimated mean incidence rate for the year. The incidence rate of CVD in August and December was significantly higher than that in October, which represents the lowest incidence rate for 1 year. The cerebrospinal fluid was analyzed in 36 cases. Abnormal findings were obtained in 24 cases, as follows: increased cell count, 7 cases, neutrophil predominance, 6 cases, protein elevation, 15 cases, increased specific gravity, 8 cases, xanthochromia, 1 case, positive PANDI test, 13 cases, and a positive result for an anti-FAP antibody test. The rate of cerebrospinal fluid abnormality observed in multiple CVD cases, 16 of the 18 cases, was significantly higher than that in single CVD cases, 9 of the 18 cases. In addition, the rate of albumin dissociation was also significantly higher in multiple CVD cases, 9 of the 18 cases, than that in single CVD cases, 2 of the 18 cases. There was no significant association between outcome and the nature of the concurrent disease. There was no significant association between outcome and the presence or absence of seizure, progressive disease, multiple infarctions, or cerebrospinal fluid abnormality. There was no association between age at clinical sign onset, or infarction site and lacunar territorial, and outcome. Symptomatic progression occurring more than 24 hours after disease occurred in 12 of the 66 cases. Of these, 9 cases showed improvement following symptomatic treatment. Of the remaining 3 cases, the clinical course was unknown in one and the outcomes of the other 2 were disseminated intravascular coagulation, due to the malignant tumor and death, without awaking after anesthesia. A follow-up was conducted in 5 of the 7 cases with increased cerebrospinal fluid cell count, and improvement was observed in all 5 cases by only symptomatic treatment, such as fluid therapy and treatment of antiepileptic drugs. A canine distemper virus antibody titer was obtained in only 21 cases, which had negative results. A good outcome was defined as the reporting of improvement on the outcome survey. The reporting of recurrence no change deterioration was regarded as a poor outcome. In the group with concurrent disease, a good outcome occurred in 14 cases and there was a poor outcome in 12 cases. However, in the group without concurrent disease, a good outcome was obtained in 15 cases and there was a poor outcome in 14 cases. The outcome survey was conducted in a total 55 cases. The observation period was between 2 months and 7 years after the diagnosis of CVD. Of the cases for whom outcome was known, 29 showed improvement, 11 showed temporary improvement followed by disease recurrence. No change occurred in 4 cases, and deterioration occurred in 11 cases. Among those who showed deterioration, an increase in seizure frequency, death or euthanasia due to poor recovery from anesthesia for MRI, death due to worsening of the concurrent disease following MRI, and unexplained deterioration were observed. Discussion. Canine cardiovascular disease occurs more frequently in August and December, similar to the pattern in human patients in Japan. Seasonal differences in climate may be a possible reason for this pattern. Transient ischemic attack may indicate the onset of severe CVD in dogs, and seizures are an important clinical sign at the onset of CVD in Japan. The most affected artery in dogs with CVD is the middle cerebral artery, and multiple cerebral infarctions are more common in dogs with abnormal cerebrospinal fluid or multiple neurological disorders. Cerebrospinal fluid analysis cannot easily differentiate between encephalitis and CVD. Albumin dissociation may indicate repeat brain infarction. Seizure does not affect the outcome of CVD in dogs, and they have relatively good short-term prognosis. However, recurrence may occur after temporary improvement. Our study included patients with progressive clinical signs, multiple concurrent disorders, and cerebrospinal fluid abnormalities, revealing new information on the clinical features of CVD in dogs. The clinical features we have identified are valuable for the diagnosis of CVD in the setting of a primary veterinary clinic. Nonetheless, the study has a few limitations, such as the need for a comprehensive diagnosis to differentiate between encephalitis and CVD and to more accurately diagnose concurrent diseases. Furthermore, a longer observation period may be necessary to evaluate long-term outcomes. In conclusion, our findings suggest that a seizure is an essential clinical sign of CVD in dogs in Japan. The occurrence of CVD in dogs varies according to season, and the middle cerebral artery is usually affected. Multiple cerebral infarctions are more common in dogs with abnormal cerebrospinal fluid or multiple neurological disorders. Veterinarians must perform a comprehensive diagnosis and follow-up to accurately diagnose and treat CVD in dogs.